You can see this tumor that is pretty sizable in your chest due to your melanoma, compared to now it has disappeared. So
It's not a miracle cure for cancer, but for specialists and patients alike, this is a remarkable moment in time.
Yeah, I can see it's completely missing here.
How do you feel about that?
Completely happy about it.
Excellent. So you're on a treatment break right now.
Still in his 40s, Christian Voth had two cancerous tumors, the first next to his ear, another in his lung. After researching immunotherapy, Voth asked his doctor about entering a clinical trial, but never imagined that after just 6 months of infusions and pills, his tumors would disappear.
Immunotherapy is surprisingly non-awful, I guess is the best way to describe it.
Unlike radiation and chemotherapy, which target and kill cancer cells, immunotherapy works differently.
But immunotherapy, the target is actually the patient's own immune system. So we're trying to activate it, wake it up, to let the immune system fight the cancer.
While every cancer is different, they all have one thing in common: cells dividing out of control and hiding from the body's defenses. The immune system's job is to seek and destroy the invaders, but when it can't find them, you end up with a tumor. Immunotherapies try to boost the immune system to help it better recognize and attack the cancer cells. One class of drugs, called checkpoint inhibitors, take the natural brakes off immune cells, allowing them to find and continuously destroy invading cells until the tumor is gone. Just a few years ago, only 5% of patients with advanced melanoma survived 5 years. Now with immunotherapy, it's well over 50%. But there can be serious, even deadly side effects.
When you wake up the immune system, the body can attack the tumor, but the body can also attack itself. So you can get inflammation in different organs, for example, the lung, the bowels, the skin, what we call autoimmune toxicity.
Hi, Elsa.
Hi, Julie.
How are you?
I'm doing great.
Once immune cells are boosted, the hope is that they'll prevent cancer cells from growing and hiding out again. But 1 year after immunotherapy, Elsa Kahler's lung cancer is back.
It's given me that increment of time to live a year longer. I'm hopeful that it will give me the time to live until they find a cure, which again, I think is what the majority of us cancer patients hope for.
And what are you PCRing anyhow?
Researchers like John Bell and his team have been chipping away at immune therapies for decades without seeing any tangible results. Now their work is changing lives in real time.
There's never going to be one single pill that's going to cure everyone. We really have to find combinations of approaches.
Another type of immunotherapy, known as CAR-T, is being used to treat certain forms of blood cancer. After removing a patient's immune cells, scientists can genetically engineer or retrain them to seek out cancer cells. In a more recent discovery, researchers also found some tumors are being penetrated by powerful immune cells, but just not enough of them. American scientists removed some of those stronger immune cells from a dying breast cancer patient, grew 90 billion more in the lab, and pumped them back in. 2 years later, there is no sign of cancer in her body.
There's nothing guaranteed, but I think this field is so full of optimism because of the results we've seen that it's worth having people enroll in these studies if they can find one that suits them.
About 20 to 30% of cancer patients qualify for immunotherapy studies or trials. Kahler is trying again. She says her goal is to be resilient and continue growing in the face of uncertainty.
I don't call myself a fighter, but I call myself a believer.
For now, Voth has a clean bill of health, but he knows immunotherapy works for some patients and not others.
I have a son, and I want to make sure that he gets to grow up and be an independent, successful young adult. And I figured I needed at least 10 years for that. So hopefully I bought myself at least that.
Voth's father died of melanoma. Scientists say every patient who receives immunotherapy offers lessons for the next generation. Christine Birak, CBC News, Toronto.
So let's bring in someone who knows this topic well. Dr. Marcus Butler works at Princess Margaret Hospital. You have dealt with immunotherapy in the past, and I'm curious, listening to Christine's story, she referenced about 20 to 30% of patients for whom this might be appropriate. What sort of cancers does this really respond best to?
Well, cancers like melanoma, lung cancer, bladder cancer, Hodgkin's disease, immunotherapy has become part of the standard of care treatment of these patients. And the reality is that most patients don't benefit from immunotherapy if you look at all the statistics. So we do need clinical trials to extend this therapy to more types of patients.
And are you looking at it as potentially a first option or maybe another option down the road?
Well, you know, it's important for patients where the best treatment is immunotherapy to give that patient immunotherapy as a first line. So for melanoma, most patients will benefit from either targeted therapy or immunotherapy as first line. But other cancers where they have standard of care, chemotherapy or targeted therapy, where they'll benefit from that better, should be treated with standard treatments. And then later on, they may be eligible for clinical trials looking at immunotherapy.
Okay, Dr. Butler, thanks very much.
Thank you.